Hello and welcome to Excellence in Practice, Voices for Better Care, a podcast by the National Centre of Excellence in Intellectual Disability Health. Here we will be sharing real stories and advice from expert clinicians and people with lived experience on improving healthcare for people with intellectual disability. We hope you enjoy this episode. I'm Ricky Kremer and I am co-hosting with Raylene Griffiths.
The National Centre of Excellence in Intellectual Disability Health recognises and respects the traditional custodians of country across Australia. We acknowledge their deep and ongoing connection to land, waters and community and pay our respect to elders past and present.
This podcast includes discussions about the healthcare experiences of people with intellectual disability. Some stories may include mentions of trauma, medical mistreatment, or discrimination, and could be distressing for some listeners. If you are uncomfortable, please take a break or skip this episode.
Hi, I'm Laura Nang. I am a guest host for Raylene and Ricky for this episode. Thank you for joining us for this episode on the healthcare for Aboriginal and Torres Strait Islander people with intellectual disability. Healthcare professionals have an important role in providing care. This is respectful, culturally safe, and the most individual needs. In this episode, we will be speaking to Kristy Petrie, a Gooreng Gooreng woman who works as a physiotherapist in paediatrics alongside Aboriginal and Torres Strait Islander families across southeastern Queensland. Her work includes supporting children to achieve meaningful goals while helping families navigate complex systems such as the NDIS. We were also speaking to Madeline Prasad, a Gooreng woman who is a First Nation disability advocate, a member of the First Nation advisory group at the centre, and member of the Daily First Nation South Out group. Hi, Kristy.
Hi, Laura.
Thank you for joining us today. Can you tell us about yourself and your experience working with people with intellectual disability?
Yes, hi. Thank you for having me today, Laura. My name's Kristy. I'm a proud Gooreng Gooreng woman born and living on Quandamooka country. I'm a physiotherapist working in the paediatric space. Much of my career has been working alongside children and young people with intellectual disability and their families. My role goes beyond physical development. It's about supporting meaningful participation, independence, and quality of life in ways that are meaningful to each child and family. I've worked across multidisciplinary teams and seen how important collaboration and family-centered care are when supporting children with complex needs.
What are some of the biggest challenges when it comes to healthcare for Aboriginal and Torres Strait Islander people with intellectual disability? How are these challenges specific to First Nation people with intellectual disability?
I would say one of the biggest challenges is that the healthcare systems aren't often designed to meet the needs of people who sit at the intersection of multiple identities. So in this case, being Aboriginal and or Torres Strait Islander and having an intellectual disability. And individuals working in this system face compounding barriers to communication, accessibility, cultural safety, and trust. There can be challenges with health literacy, language differences, and navigating complex systems, particularly when services are not culturally safe or inclusive. And also, intellectual disability can be misunderstood, leading to diagnostic overshadowing, where physical or mental health concerns are mistakenly attributed to disability rather than being properly investigated. For Aboriginal and Torres Strait Islander people, these challenges are compounded by the ongoing impacts of colonisation, intergenerational trauma, and historical mistrust of healthcare institutions. When services don't acknowledge this context or actively work to build culturally safe relationships, people can disengage and miss out on care altogether, which is really not okay.
Have you seen Aboriginal and Torres Strait Islander people with intellectual disabilities struggle to get the health care or treatment they needed? What happened and what should have been done differently?
So yes, I've seen many situations where individuals struggle to access appropriate care, often not because of lack of need, but because the system wasn't flexible or responsive enough. In some cases, families weren't listened to when they raised concerns, or behaviours were misunderstood rather than explored as potential signs of pain, distress, or unmet needs. I've also seen instances where appointments were rushed, like communication wasn't adapted and cultural considerations weren't acknowledged. What should have happened is earlier involvement, what should have happened differently is earlier involvement of family and community supports, clearer communication, and a willingness from healthcare providers to adapt their approach rather than expecting the person to fit standard systems.
Thank you for sharing that. Can you tell us about a time when you were able to work with a patient who has faced some of the challenges you said earlier in the past? How do you make this experience positive for them?
I certainly can, Laura. So I worked with a child who had previously found healthcare settings overwhelming, and both the child and the family had disengaged from services as a result. There was a history of appointments that felt rushed and stressful, which understandably made both the child and the family anxious. So to change both this child's and this family's experience of receiving support, I lent into my Aboriginal ways of connecting through yarning, deep listening, and relationality. So building a relationship that's built on mutual trust rather than a transactional in-out approach. The sessions were slower, more predictable, and guided by what made the child feel safe, often through play and routine. I took the time to listen to the family, understanding their priorities, and involving them in decision-making in every step of the way. So that way, therapy and support was happening with them rather than to them. By adapting communication, being flexible with goals, and allowing trust to develop over time, therapy became a much more positive experience for both the child and the family. The progress wasn't just measured in physical outcomes, but in the child's comfort, engagement, and willingness to participate, which ultimately led to much better outcomes.
Reflecting on your experiences, how has your approach to care evolved over time to provide more inclusive care for people with intellectual disability?
When you first leave university and start your career, it's really easy to focus on clinical outcomes and rigid treatment plans and home programs, like the bread and butter of what you've been taught at uni. You write out a tick box and follow that through. However, over time, my approach has changed. It's not focused so much on that rigid tick box anymore. I've learned that truly inclusive care requires a broader approach. My approach has evolved to place greater emphasis on listening, cultural humility, and partnership with families. So care is something that's co-designed rather than delivered. I'm much more aware of my own assumptions and am more intentional now about creating spaces for family to share their knowledge, priorities, and concerns. This shift has helped me provide care that is more respectful, responsive, and effective for people with intellectual disability.
For other healthcare professionals who haven't worked with Aboriginal and Torres Strait Islander peoples with intellectual disability before, what are some changes or suggestions you could make that could make you could make that will help them improve their practice and deliver more effective care?
That's such a great question, Laura. Thank you for bringing that one up. One of the most important things is to approach working with mob people with intellectual disability, any sort of difference, even with you, to yourself, is to approach this work with openness and humility. You don't have to have all the answers, but you do need to be willing to listen and learn. Take the time to ask families what works best for them, and don't make assumptions on about understanding or preferences. Focus on a strengths-based approach. This is well documented to be the most effective form of practice for mob. Using plain language, visual supports, and flexible appointment structures can make a significant difference. Building relationships with Aboriginal health workers and community-controlled organisations is also crucial, as they bring invaluable cultural knowledge and insight. This isn't just isolated to community-controlled health organisations, but also the extended community and family around the child if working with children. Get to know them and get to know their culture and their knowledge. Another important suggestion is to consider for clinicians to develop their cultural capabilities.
Can you talk more about what is culturally safe practice? How do you go about adapting your practice to be more inclusive?
Cultural safety is the development of an environment, particularly looking at health and workplaces, where individuals feel respected, valued, and safe with their identity and culture acknowledged, rather than negatively impacted or denying. It's moving away from power imbalances, racism, and discrimination, allowing people to define whether they feel safe in that space. So looking at an Aboriginal Torres Strait Islander view of health and wellbeing, it's known as the social emotional wellbeing model, and it's a holistic, strengths-based concept of health that extends beyond mental health to include connections to the body, mind and emotion, family and kinship, culture and country. So it takes into effect the historical determinants, political determinants, and social determinants of health, and how all these bits of information come in to make up one person. So rather than focusing purely on if the client has a sore knee, what else is that could potentially be making the picture to make them up to their self and then impacting their health. I would say adapting my practice has sort of come in multi-parts. So one, spending time with my patients and clients, they really are, because they are the experts in themselves, and listening to the parents, because they are the experts in their child, following forward. But then working with my colleagues, so working across I work in a multidisciplinary team, so working with my occupational therapists and speech pathologists, and getting information with them about different, communication modalities for AAC, for example, regulation strategies and things like that to incorporate into my session, and treatment planning, but then also working with other physios working in this space, having a yarn with them, connection with them, and finding out what's working for them, strategies that they recommend. So a lot of different places to come with that. There is extra study that you can do that I've undertaken, and for example, through courses, professional development courses through the Australian Physio Association. They've got some courses, and there are other ones around that I've also undertaken as well.
Thank you for sharing that. What have people with intellectual disability taught you about how healthcare should be delivered?
I have learned so much from working with my clients with intellectual disability. I don't think I go a session without learning something new from working with them. They've taught me that healthcare in general works best when it's flexible, relational, and human, that we as clinicians need to adapt to people rather than expecting people to adapt to our systems. They've taught me that sessions should be paced appropriately, respectfully, and grounded in dignity. I've learned that communication is so much more than words. It's about observing, listening, and responding to everyone in ways that make them feel safe and understood. They've also taught me that success in healthcare isn't always about achieving predefined outcomes, but about supporting participation, comfort, and autonomy in ways that matter to the person and their family.
Is there any other advice you would give to healthcare professionals who want to make their practice more inclusive and accessible to people with intellectual disability?
Remember that inclusive practice isn't a checklist. It's an ongoing process of reflection and learning, both with cultural capabilities and just accessibility in general. Be willing to adapt, to make mistakes and grow for them. Don't be afraid to say the wrong thing. Ask, find out how your clients, patients, families, children wish to be supported, addressed, and what their goals are. Seek feedback from these families and colleagues, especially those with lived experience or cultural knowledge. At its core, inclusive care is about respect, curiosity, and partnership. When healthcare professionals commit to those values, they create spaces where people with intellectual disability are not just included, but genuinely supported. And one other thing I'd say is never underestimate your clients with intellectual disability. They will surprise you every day and make it a joy to work with every day of how much surprise they can bring along and share with you every day.
Thank you for your time and for sharing all the great information.
Thank you for having me today, Laura. It's been great to hang out with you.
Thank you, Kristy, for sharing your experience and story as a health professional. We will now hear from Madeline, who will share her experience in the healthcare system. Advice on healthcare professionals.
Thank you for joining us for this episode on Aboriginal and Torres Strait Islander healthcare. Can you please start by telling us about yourself and your work?
Yeah, hi, Raylene. My name's Madeline Prasad. I'm a Guja Tamara Wurundjeri woman, and I like to do an acknowledgement to country. I like to pay my respects to the past that are dead and to alive here, and for doctors, lawyers, people in jail, drug addiction, and mob, because, we need a lot of help here today. And, we've got to stand up for mob, and I thank you, and I have a very strong Catholic faith, and glory to brother, boys, sister, girls, the mob, the elders, and everyone. Thank you. Yeah, I do a lot of different type of consult work, and I'm on different committees, and I like to help people and mob, and especially understanding about disabilities and the NDIS and racism. You can't be racist, and people in our community are very illiterate. So, and cultural safety, awareness training, education and training. You need a lot of help. And so we've got to stand up like a good disability advocate and make it happen. But the best thing is having knowledge and training, not this academic jargon, less writing and more pictures. And good, clear communication goes a long way. In a care plan with your support workers, with community, with your support coordinator, with anything you do, it needs to be easy and simple. But a lot of people find it scary and hard to stand up and make a change. You have to make things happen.
Can you tell us about what your experience has been like in the healthcare system?
I went into the women's hospital, and I had, there's a part there for people with, disabilities and, if you've got bad depression or drug addiction. And they were really good. The Wing Clinic with Cherie, I had my third baby there. They really supported me there. Give you stuff for your baby, link you into support if you can't do it. But there's a really good part there that helps people get the support they need and help them with housing. They're really there to support you and help you, the Wing Clinic at the Royal Women's Hospital. And I was very good, and I listened and followed, and they really help and support people, not like these other bits. But I had a really good positive experience at the Royal Women's Hospital in the Wing Clinic, and I was a very good mum. And even if you do need help, they're there to help you.
Thank you for sharing your experiences. And We know that accessing effective health care for Aboriginal and Torres Strait Islander people with intellectual disability can be hard. What challenges have you had accessing health care or with healthcare professionals when going to the doctor?
Well, you need to go to the doctor, you need to communicate, and they need to listen to you, not speak academic jargon, and they need to interact with. They don't understand Aboriginal people and mob, and they're very smart and academic, but we do things very differently. So they need to learn our training and knowledge to be able to communicate with us, or else it's awful. Going to the doctors, going to the hospital, good, clear communication you need. I've had very bad experiences going to the doctor. I said I need some help with something, like getting a pap smear or getting the pill, or, talking about abortion, like for my friend, and they go round and not good, clear communication. You need it simple and easy. Good, clear communication goes a long way with pictures and less wording. Our doctors, they got engaged with professionals without my verbal, without my written consent. That is a no-no. And they've done it to a lot of mob and not a lot of other people with intellectual disability in jail, with an IBA. It's really wrong. They shouldn't do this. You can get into a lot of trouble. So you need verbal consent and written consent so they can speak to organisations about you. Some of their body language, you should look at a client in the eye, and you should be having positive expression with people with disabilities or brain injury. They shouldn't be far over in the corner and you're over here. It's not very engaging, and it's not a professional working relationship.
Can you tell us about a time when you felt listened to, understood, and comfortable with a healthcare professional? What did they do that made the experience a good one?
Well, I can coordinate my support with my psychologist, psychiatrist and OT and my doctor. So we had a face-to-face meeting, and it was for 5 hours. And so I sat there and I said, I'm in charge of my life, so can you please all listen? You need to learn, and I need to educate you with knowledge and training. You don't have to educate me. So I said, this is what I need. This is type of help I need. I'm educating you. Can you please listen and actually do it? I had a really good positive experience sitting in the Turak pub with my support coordinator, the psychiatrist, my OT, and everyone. We went there for lunch, and I said, excuse me, I was really happy. I finally got them all together. And I said, you're all amazing. You're all listening to me finally with communication, what I need to achieve and get done. And my support coordinator, my doctor, my psychiatrist, my psychologist and OT were there. So we simplified it, and I made it happen. And it's about me, not all of them. It's about everyone working together to achieve what we need to achieve. Listen to me and things will happen. Easy flowing, easy practice. And I really was blessed. I made it happen. I can do it. It was such a positive thing for me.
Thank you for sharing your more positive experiences. When going to the doctor to get treatment, how can doctors make you feel more comfortable? Are there any tools or resources that healthcare professionals have used that help you to better understand and feel comfortable?
They need to, read your file, really understand your dual disability, look good, easy language, good body, listen to you, and not talk too fast, because a lot of them talk academic language. Lucky I'm intelligent and smart, and I'll ask a question if I don't understand anything. But a lot of people in mob and people with intellectual disability or brain injury are too scared to stand up and ask a question so they can feel really good and secure in their life. It's very scary out there, but the doctors have to listen to us. We're their patients. So they need knowledge and training, how to work with people with a brain injury or people with any type of people with disabilities, because we can lead the way with my unique live experience. They need to listen.
What do you wish healthcare professionals knew about Aboriginal and Torres Strait Islander healthcare when treating people with intellectual disability?
They need to listen to people. Just don't throw people in the psych ward. Listen to a person, what's happened in the past. Trauma from the past can carry on, It's so wrong how they treat people. They need to learn and listen, and less academic wording. Let the person speak in the meeting, like me speak in the meeting. Not all the professionals speak. It's me speaking how I'd like to be treated.
Yes, absolutely.
In doctors, lawyers, psych wards, the Jungais, in mob, in community centres. You're a person and you need to be helped, so they need to listen to you. I'm a unique lived experience. They might have academic degrees, but they don't know how to do cultural safety. They don't know how to engage with mental health workers. They don't know how to engage with lawyers. They need to engage with people and let the person pick who they want in their life to get professional help to make it all happen. You need education and training to work with a mob and to work with people with disabilities, brain injuries and intellectual disability, or else you're not. And I said, you've got to be nice and polite. Make it a bit more welcoming, or go out into the garden so that people can sit out and do cultural training. It's you got to be put yourself out there and face your demons head on, and you have a good working relationship with your client. Maybe put some pictures around the office or outside, or some music, make it more cultural, plants.
Is there any other advice you would give to healthcare professionals who want to make their practices more inclusive and accessible to people with intellectual disability?
Listen to people with, being Aboriginal, easy reading, make it loving, a positive experience, not a negative experience, and engage with their care plan team and engage with them. It's about them telling their stories and connecting in a working relationship. You've got to make it easy, no jargon, no academic wording, lots of pictures and less wording, and make them feel really included with their support network and their care plan. We can lead the way because we're unique lived experience, or go out and tell community and the MPs how to respect mob and community, and how to educate and teach doctors, lawyers, police and everyone. I belong to the Black Fellas Shout Out group. We made a documentary and we educate organisations around we've all got disabilities, but how to work, culture safety training, 7 deadly tips. And we're amazing and we're really good, and we're getting it out there because government, doctors, lawyers, police really don't know how to work with people with a brain injury or intellectual disability. We've been on the Black Fellas Shout Out group for about 2 years, and we get out there and we really show Parliament and government how we should deliver and do things, and they have to interact and make sure it happens, because a lot of people don't know how to work with people with mental health issues, disabilities, brain injury in the psych wards, in the doctors, in the police, in courts. So we need to get out there and show them how to do it with our all unique lived experience, knowledge and training, and reading all their prior history before you make, be nice in the surgery or the doctors at the hospitals. You need to be loving, friendly and kind and understand Aboriginal mob. And the key is having wisdom and knowledge and training. I really enjoy what I do and deliver, and I want to make a change in Aboriginal health, in the psych wards, in doctors, with my 7 deadly tips, or through the Black Fellas Shout Out group. I have a lot of good traits about myself, and I've got unique lived experience, so I can lead the way and educate other people. Doing hard work pays off. Going on all these committees, you must stand up and make a change, and the governments and organisations must listen to us, because we can lead the way with our unique lived experience. And I'm proud to be an Aboriginal woman, and I'm proud to make a change for society and Australia. And there's a lot of red tape with Parliament. They need to engage and listen to us.
That's what we hope for, Madeline.
And I really enjoyed doing this.
I enjoyed it too. Thanks very much. Madeline, thank you for your time and for sharing your story with us all.
Thank you for listening to Excellence in Practice, Voices for Better Care. We hope you enjoyed the episode and learned more about delivering better care for people with intellectual disability. If you've been affected by anything discussed in this episode, please know you're not alone. Support is available. If you're in crisis or need someone to talk to, you can contact Lifeline at 131114 in Australia. To learn more about the work of the National Centre of Excellence in Intellectual Disability Health, or to get involved, visit our website nceidh.org.au.